Hello, I'm Hayley Thomas, Chief Executive of Powys Teaching Health Board, and I would like to share with you the annual plan for 25-26. This is year 2 of the 5-year integrated plan, 24-29, and sets out the strategic priorities and critical actions that will support us to achieve our wellbeing objectives. An ambitious 10-year strategy for health and care in Powys was developed in 2017. We are in our second year of our 5-year integrated plan, which sets out the work of the Health Board in the short, medium and longer term to create a healthy, caring Powys. The plan remains centred around the delivery of safe, timely, effective, efficient, equitable and person-centred care. And it sets out how we will work with partners to shape the future of healthcare in Powys on a health and care model that enables us to be better together. The Health Board directly provides services to 133,000 people across a wide range of community sites, which includes 9 community hospitals around the county. In addition to these hospital sites, services are provided in a range of community clinics and centres, such as GP practices, pharmacies, dental surgeries and optometrists in towns across Powys. We have the oldest estate of all the health boards in Wales, with most predating the NHS being established in 1948. The estimated total cost of repairs to bring the estate into a satisfactory condition is around 70 million. There has been investment to improve the patient and staff environment and to reduce the backlog maintenance on some of our sites, but significant challenges remain. Digital connections have improved across sites and people's homes, which has enabled the ability to support virtual appointments, to share patient information across primary and secondary care, and to access high quality information and advice for self-care. There are challenges and opportunities for the workforce across health and care, including the community and voluntary sector, due to the sparse rural geography, older age profile and outward migration of the younger workforce. There is an urgent need to transform healthcare to respond to the challenges of today and to meet the needs of the population for the future. We need a plan to meet the needs of our communities over the next 10 to 25 years and to continue to support people to stay well. We need to plan workforce supply and reduce our reliance on agency staff. And we need to achieve this in a way that recognises our legal duty of quality. We need to respond to changes in illnesses and treatments, including finding the right ways to focus more of our resources on prevention. And we need to deal with the issues with our estate and ensure it supports our future service requirements. And finally, we need to develop those options for the future that the county can afford. Better Together achieves this by harnessing the skills and talents of the people of Powys, by making best use of the resources and assets in the NHS and across local organisations and communities, and by responding to the challenges and the opportunities we all face to improve quality and outcomes.
The plan on a page sets out the strategic priorities and critical actions for 2025-26 that will support us to achieve our wellbeing objectives. Focus on wellbeing, early help and support, tackling the big 4, joined up care, and our enabling objectives, workforce futures, digital first, innovative environments, and transforming in partnership. As severe financial challenges remain, the Health Board has an ambition to recover its financial sustainability in as short a timescale as is practically possible. The plan aims to work with partners to develop a whole system plan to prevent poor health instead of treating the consequences, identify risk factors which will impact other conditions such as diabetes, cancer, cardiac, stroke, dementia, and respiratory illness, implement key interventions including immunisation, being smoke-free and physically active, having a healthy weight, and not misusing alcohol and substances. Vaccination is a vital tool to mitigate the effects of viruses, protecting the vulnerable and supporting the resilience of the NHS and care systems. There will be an increased focus on family health for the most vulnerable children, young people and their families following the pandemic. A Powys Women's Health Plan will be developed to improve access to healthcare for women, children and families. The Health Board has an ambition to become a UNICEF baby-friendly organisation. There will be a children's focus for continuing healthcare, ensuring that those children with complex needs are receiving the service they require. Improvement in neurodevelopment services for children and young people will also be prioritised. As a provider of mainly primary and community care, this is a focus on early help and support. There are plans in place across general medical services, dentistry, community pharmacy and optometry to track provision and improve access in line with identified population need. Planned care remains a priority and will include transformational work being led through the Better Together portfolio. The Powys clusters have all identified planned care and diagnostics as priorities in their plans. Complex and continuing healthcare provides care for those who require intensive support. The aim is to facilitate the best outcomes for the most vulnerable patients throughout a whole lifespan, including the end of life. There is a growing demand in this area and increased complexity due to the rurality of the county.
Tackling the Big Four. The Big Four are the areas of greatest impact to health and well-being in Powys, these being cancer, circulatory disease, respiratory and mental health. In Powys, more people are living longer with multiple conditions including reduced mobility and chronic pain. This potentially has further impact on mental and social well-being and quality of life. The plan focuses on diabetes, recognising that improvements in prevention and care for this condition have wider benefits across other major conditions. Cancer services will continue to be delivered in line with the Cancer Improvement Plan and Improving Cancer Journey programme. We will continue to engage about the provision of stroke services across Wales and England. Mental health. Mental health services aim to offer a range of support, accessed in a straightforward and timely way, close to home, based on need. This approach recognises that the person is the best guardian of their own lives, including their physical and mental well-being. As part of the Mental Health Transformation Programme, work is ongoing to design community services and inpatient care, responding to changing and increasing demand. Joined up care. Joined up care is connecting health and social care services to improve well-being, promote early help and ensure that people receive the right care at the right time and in the right place. Powys residents access urgent and emergency care from a range of providers in England and Wales. Minor injury units are provided in Llandrindod-Wells, Welsh Bull, Ystrad Gunlais and Brecon hospitals, and also primary care settings. The Health Board's commissions care with around 14 health providers in both Wales and England for acute and planned care and specialised services required by the Powys population. The Health and Care Strategy for Powys sets out the ambition to improve commissioning, delivering more services in county and greater continuity of care.
Workforce futures. The workforce is the most critical asset of the Health Board. There are opportunities for the future workforce to develop in new and innovative ways, linked to transformational work on Better Together. There are also challenges with an ageing population and difficulties in recruitment and workforce supply. It is also essential to recognise the vital contribution of volunteers and unpaid carers, whose role is particularly critical in a rural county. Digital first. There have been significant advances in digital healthcare as a result of the pandemic. Work is ongoing to improve patient care, streamline operations and support innovation, as well as improving efficiency, enhance security and explore artificial intelligence. By using digital technologies, the aim is to create a more effective and patient-centred healthcare system for Powys, including digital tools to increase patient engagement, improve clinical outcomes and support healthcare professionals in delivering high quality and safe care. Innovative environments. Powys Teaching Health Board has the oldest built estate in Wales, so it is crucial to identify and harness innovative and collaborative approaches. The plan aims to deliver environments which improve access, coordination and integration of services, especially for remote, rural or underserved populations. Climate change and carbon reduction is also a key goal for the Health Board, and work is ongoing to reduce the footprint of public sector premises across Wales. Transforming in partnership. We are working in partnership across Powys as well as the wider Mid Wales region and nationally, both in Wales and across the border in England. Work is ongoing with the Regional Partnership Board to prioritise investment and effort to the areas of greatest system pressures. There are multiple strategic plans in England and Wales that relate to health and care provision for residents of Powys, and these are monitored carefully. There is continuous engagement as well as targeted engagement and consultation, reflecting the strategic requirements of the Health Board, local partnerships, regional and national programmes. Diolch yn fawr iawn. Thank you very much.